ಬರ್ತೀನಿ. ಮೇಡಮ್ ನಮಸ್ತೆ ಮೇಡಮ್. ಹಲೋ ಮೇಡಮ್ ನಮಸ್ತೆ.
Yes, नमस्ते सर.
मैडम नमस्ते.
नमस्ते सर, कैसे हैं सर?
अच्छे हैं मैडम, आप कैसे हैं मैडम?
मैं भी ठीक हूँ सर.
यस सर, 2 मिनट हम स्टार्ट करेंगे मैडम.
बिल्कुल.
2 सेकंड. यस मैम.
जरूर सर.
हेलो बुद्धि सर.
Sir, no?
Yes sir.
Hello sir, namaste sir.
We will start the session sir. Just a minute sir. I heartily welcome today's guest speaker, Dr. Manjiri Keskar madam. Myself, Dr. Vinod Jadhav, Professor HOD, Department of Shalakya Tantra, Sri Vijay Mantesh Ayurvedic Medical College, Ilkal. On behalf of my department and principal, Dr. Keskar sir, on behalf of our management and all the UG and PG students, I wholeheartedly welcome to you all. Now I am requesting Dr. Santosh Pujari sir to give an introduction note about our today's guest speaker, Dr. Manjiri ma'am. So over to Santosh sir.
Thank you, sir. Thank you so much. Om Sri Guru Bhyo Namaha. Good afternoon to all. Today, I'm very happy to invite one of the best guest speaker of Shalakya family. Initially, I am welcoming Dr. Manjiri Kesarkar, Madam, to our national level online webinar series number 3. I am heartily welcoming you, Madam, for this. And I am gratitude to introduction about Dr. Manjiri Keskar, Madam. Dr. Manjiri Keskar, MD, PhD, Professor, Department of Shalakya Parul Institute of Ayurveda, Parul University, Vadodara, Gujarat, and holding additional charge of DYMS and NABH coordinator at Parul Ayurveda Hospital, and also working as a General Secretary of TAS India for 2019 and 2021. Madam, having 25 years experience of clinical experience and 15 years of academic experience, and Madam invited as a guest speaker in many national and international conference. Madam published many number of articles, and Madam guided many number of PG and PhD students. Among all PhD students, one of them, I am very lucky to have. I am having a very lucky to have such a great doctor as my PhD guide. And lastly, Madam believes in a integrated approach for a betterment of mankind. Thank you so much, Madam, for receiving our invitation. Now, time to listen our guest speaker speech about Adhimantha and its Chikitsa. Thank you so much, Madam.
Thank you very much, Dr. Pujar, for your kind words. I especially thank Dr. Das sir, our principal, SVM Ayurveda Medical College. Then Dr. Jadhav, Vinod Jadhav, who is the HOD of Department of Shalakya Tantra, Dr. S.S. More, Dr. Santosh Pujar, and Dr. Prema for giving me this opportunity for interacting with you. Today I will be talking on glaucoma, Adhimantha and its treatment. Yes, we can say while talking about Adhimantha, we can say that it is a treatment because Sushruta told this Vyadhi as a Vedana Sadhya Vyadhi. So definitely, if we follow the Ayurveda principles for this, then we can definitely treat this disease. And if the patient comes to us at an early stage, then definitely the prognosis is better, and we can arrest the atrophic changes of the peripheral retina, and we can give the quality life to the patient suffering from glaucoma also. Even with the medicines and all that. So to start with, I will share the screen now, sir.
Okay, madam. Continue, madam.
Can you see my screen now? My screen is visible, sir?
Madam.
Okay.
Visible, madam.
That's great. Yeah. So today my topic is Adhimantha and its Chikitsa. So to start with, So as Dr. Santosh Pujar said, that I am the follower of an integrated approach. So it is always better to follow the integrated way to treat the things, to manage the things, because what happens many times that if we stick to one pathy, so it may not be better for the mankind, for the patient as a patient. So it is always better. So I believe that it is always better to go for the integrated approach. And so as we are in the 21st century, so while going for the whenever we see the patient, even so all our patient, all our doctors today, the new young generation, endoscopy, they see the angle of anterior chamber, they see the retina, how much degeneration is there, atrophic changes are there. So I believe, so I will start first with the glaucoma, and then I will gradually come to the Ayurveda aspect. So what is glaucoma? Glaucoma is a group of disorders in which intraocular pressure is raised above the tolerance limit of the affected eye. So usually the 16 to 18 some mm of Hg is the normal intraocular pressure, but here the intraocular pressure IOP is raised above the tolerance limit, so resulting in the damage to the optic nerves. So the main thing, the marma about glaucoma is that there is the intraocular pressure, there is the what we call it as the pathology is there in the anterior segment of the eyeball actually happening, but the reflection is there in the posterior segment. So this is the irreversible changes occurs in the retina. So we have to have a very keen look at the patient whenever we assess glaucoma. So this is the normal aqueous flow, your sacral outflow. So the ciliary bodies, and the ciliary body secreting the aqueous humor coming from posterior chamber to coming to the anterior chamber, and then from the trabecular outflow, trabecular meshwork, it comes into the circulation. So here it is the, so this is the thing where the pathology is happening. So the secretion from this side and the outflow from this side. So there are, the pathology is here, but the reflection of the pathology is, of course, is here also. So the how Sushruta has decided, has told us that this Abhishanda and Adhimantha is also, it is Sarvagat Vyadhi. He knows that it affects the eyeball as a whole. So that is very much important. So this is the worst situation, worst scenario of the glaucomatous changes in the optic disc and cup. So this is the cupping of the optic disc. Whenever we imagine that the cup and the saucer, or the cup and the disc, so usually the normal ratio is 0.3 cup disc ratio, but gradually it happens, it goes to 0.9. So it means that all the disc disappeared, and it becomes, it turns into the cup of. So whenever, dear students, whenever you go for the fundoscopy for the patient, and I suggest you to always go for the fundoscopy whenever patient comes to you, whenever he has the frequent changes in the near correction, or whenever he has a mild headache, because there are two types of glaucoma. So I'm going to that also, because in POAG, it is very much important to assess the retina every time, because the patient is symptomless. So all that thing is that whenever the patient is having the tubular vision, then only patient will come to us, and at the time we can't help the patient to restore his vision. So it's always better to go for the fundoscopy. I always tell to my students also that you please always put the torch into the eyes of your family members, of whoever comes to your in your contact, and see the pupillary reflex, see the cornea, see the corneal curvature, see the depth of the anterior chamber, because you have to judge the depth of the anterior chamber. You can't measure it every time. So then you go for the color of the lens, and then as and when possible, please dilate the patient and go for the fundoscopy, which is very much important to diagnose many diseases including glaucoma. So this is the you can very well see, this is the normal optic nerve. There is a slight depression in OCT also, we can see this depression, but here this is the complete cupping. We can see that 0.7, 8 or 9 even. So this is the CD ratio, and we can very well see the traction on the ganglion cell layer. And here this is the damaged optic nerve, we can say. So at this stage we can't help the patient much. So early detection is always better for patient and for the doctor also to treat the patient. Moving ahead, so this is again, this is the cupping of the disc, you can very well see, and this is the actual visual field, how the patient sees when patient is having glaucoma. So the peripheral visual field is very much affected, and patient can only see the central portion only. So to base what we have to go for the evaluation of the glaucoma, first of all we have to have the visual acuity of the patient, but many times the visual acuity is normal, because as I said that the central vision is very much normal for the patient, because the pathology starts from the peripheral retina. So visual acuity is very much important. Then of course slit lamp biomicroscopy to see the angle of anterior chamber. Then the applanation tonometry is to see how exactly what is the status of the intraocular pressure. Then you can go for the gonioscopy also, if it is the gonioscope is available at your place, and without fail ophthalmoscopy to see how much peripheral retina is damaged. And of course to come to the conclusion to have the, because ophthalmoscopy is again the objective, it is not the objective criteria, it is subjective criteria. So if you are going for some research work or all that, then you have to have the some objective criteria also to prove your results and all that. So perimetry is very much important there, so that you can have the report of the patient to say that this is the earlier perimetry report, and this is the perimetry report of my patient after the treatment. So if there is a slight change, even I will say even 5-10% result is also there in the perimetry report, then also that becomes significant, because it depends on how the patient is responding to your treatment. So perimetry again, and one of the most important thing I always tell to my students also, that counseling of patient is very much important. You can't say that nervous your patient. You can say that yes, we will try, हम try करेंगे, हम ये treatment देंगे, हाँ देर लगेगी. Don't don't give the guarantee to the patient, but definitely you say that we can try, and definitely when trying, if you are trying from your bottom of your heart, then you will definitely get a success. But please let the patient should have complete faith in you whenever you are treating the patient with the Ayurveda or any pathy. So that is very much important. Then what are the etiological, why glaucoma occurs? There is why it occurs, no one knows actually. How it occurs, everyone knows, but why it occurs, so no one knows that. No one knows. But there are some factors, which anatomical factors like thin cornea is there, optic nerve, sensitive optic nerve is there, eye tumors, eye inflammations. These are some of the factors which may lead to glaucoma. Okay, so here I want to, why I wrote eye inflammations here. So in Ayurveda also, what Sushruta says that Abhishanda is the root cause of all the diseases. So all eye inflammations, Abhishanda, Abhi means more, Syanda matlab srav. whenever there is the clogging and blocking of the vessels, then the excessive discharge will come up from some another route, from another way, and that inflammation may cause the first it will cause the inflammation, that vimarga dosha, we can say that. Then it may cause the many symptoms. It may lodge wherever the sthana samshray is there. It depends where the vyadhi sthana samshray is, and depending on that, the vyadhi, we can have the vyakti of the vyadhi. So eye inflammations is very much important. Don't ignore eye inflammations. Okay. Then what are the etiological factors for general factors? Age. Again, the higher as age increases, the risk of glaucoma increases. Sex, not specific, but males are affected more. So types of personality, which persons affect more? The introverts are more affected. The so I used to tell to my students that speak up. There should be at least one person in our life to whom we can share any damn thing, whatever we want to. So it is always better to open up. So don't be introvert, or if you are introvert, then find a place, one place at least, where you can have all the you can open up very frankly. So that is very much important for the Sharira Vyadhi, to control Sharira Vyadhi and Manas Vyadhi also. Okay. So nowadays the newer generation, younger generation is not having actual friends. They are there in the virtual world. So on the Facebook and Insta and all this, so I got less likes, I got more likes, he got more likes, I got less likes. And these simple and very immaterial things are affecting the new generation nowadays. That is very much dangerous for the society. So I think we should have one friend, one very good friend to whom we can talk whatever we want to. Then the family history, as I said, it is hereditary in nature. The spelling is wrong, I'm sorry. So it is hereditary in nature. So if it runs in the family, so you have to have a close look. If the mother and father is having glaucoma, then the kids, even the parents should be educated that their kids should not have the glaucoma. So what care they have to take? They should consult to the doctor at very early age of the kids. Again, these are the precipitating factors, as you all know. High myopia, because of that anteroposterior diameter increases, the pupil is dilated always, so the angle of anterior chamber is closed, and that leads to glaucoma. Then the diabetes, any metabolic disorder is there, then the patient is always at the high risk of glaucoma. Not only glaucoma, but many other diseases, like we are talking about COVID-19. So these patients, obese patient, hypertensive patients, are at more risk. In the same way, here also in glaucoma, diabetes, obesity, high blood pressure, all these are the precipitating factors. Then very much important thing is working or reading in dim illumination. Nowadays the new generation is, what they are doing, their brightness or the mobile brightness is very low, so that their parents should not recognize that they are using mobile, and in that dim illumination they are seeing the mobile. So that is very dangerous. That is again one of the predisposing factor to the glaucoma. So please, my dear friends, young friends, please put the appropriate brightness for your mobile. Don't use mobile after when you put off the light. Don't use mobiles. Okay, that is very much important. Doing late night work. Okay, so there are many occupations where we have to work for late, but if you are doing that, then you have to follow some sadvrutta, which is there in the Ayurveda, which is described in Ayurveda. So that is also very much important. If you are working late, do consult the nearest Ayurveda person. He or she will tell you what to do, what not to do. because you can't leave your work, you can't leave your job, you have to live with your job also. So it is very much important for you to consult to the nearest Vaidya. He will tell you about the dinacharya and rutucharya to be followed in case of Ratrav Jagara. Okay, then the emotional stress and anxiety, this is the part and parcel of the 21st century students. But we have to live with that also. We have to accept the things, and we have to move ahead. So being under emotional stress consistently, or being anxious consistently, what will happen to me, to my career, to my family, this will not lead to any of the any of the solution, but it will increase to your problems. So please open up yourself, try to solve out the things at an early stage. Everywhere it is important. It is important in glaucoma also, and it is important in your personal life also. Don't allow the things to proceed further. Arrest them at an early stage, take the solution and move ahead. Use of corticosteroids and mediatic drugs, that is again the precipitating factor for the glaucoma. Now, as you all know, there are two types of glaucoma usually, or grossly we can say primary closed angle glaucoma, which we can say that is the acute stage, and the primary open angle glaucoma, which is the chronic this thing, and which is usually symptomless. Santosh sir, can you hear me? Vinod sir, is it okay?
Okay, madam, nothing to worry.
Yeah, great.
No problem.
So these stages, this is the first, we will go for the acute stage, acute congestive glaucoma, which has 4 stages: prodromal stage, constant instability, congestive attack, and then it becomes, then it changes to chronic congestive stage, and finally the absolute glaucoma, which no one can treat. So what are the symptoms of prodromal stage? Usually patient is having halos around light. Usually patient complains about the halos around light. Then there is a mild headache. At this stage, if the patient comes to us at this stage, my dear friends and students, then please ask them to have Langhana. I'm going to that also, to the Ayurveda, this thing. But I want to tell you that if the patient comes to you at this stage, this is the very early stage, prodromal stage. So you can even control the glaucoma only with Langhana at this stage. That is what I want to imbibe on you, that there are so many simple small things which we can do in our day-to-day practice, but it doesn't cost much. Okay, but many a times what happens that people feel that, oh, it is so cheap and it is so simple, so how it will be helping to control my vision, or to restore my vision, and usually patient ignore that. But please convince your patient that there are so many simple things which helps in a bigger way. So these are the signs. Whenever you take the intraocular pressure, it will be raised, but there will be no congestion as such. But corneal edema may be there in the prodromal stage. Then the stage comes that is of constant instability. So here the attacks becomes more regular. It comes regularly. Then the self-termination attack is due to, many a times it happens. Always whenever you see that whenever there is a disease, there is a stage of healing. So our body is such that it tries to heal the things. It tries to normalize the things. In the same way here also, even with a small sleep, in a small nap, the attack may go. Or due to, or the physiological meiosis, whenever there is a meiosis, the angle of anterior chamber will open, and the flow will be there, and then the patient may have relief. But again, here also, if the patient comes to you, then at this stage you can have the Langhana. Again, any for I always tell you that akshi kukshi bhava rogaha pratishaya vrana jwaraha panchaite pancharatrena rogaha nashanti Langhana. There are 5 diseases which can be solved, which can be cured completely with the help of Langana only. Langana means not complete upwas. It is not like that you have to starve. All Langana means Laghu Ahara, and Langana means you have to have the diet just 1/10 of your capacity. Okay, if you take the two roti at a time and a rice and a bowl of rice and a bowl of dal and vegetables and salad, cut it down to 1/10, and that is your Langana Ahar. So, of course, it depends on the prakriti of the patient. Okay, but as and when required, you please take warm water. You please take Shadanga Paniya. You please have Trifla Musta. You please give the patient these things for Dipana Pachana, and the patient will feel very light, and all the symptoms will wave off. But it is, again, as I said you, that these are the simple things. If I advise my patient to don't have meal at that on 2 days and just have Shadanga Paniya or Mudgayusha, then patient will look at me like, what are you telling, madam? But please, my dear friends, it helps like a miracle. So please try to convince your patients that these are small things, but it helps in a very bigger manner. Okay, then the stage comes, if both the stages are, if we ignore the stages, then the stage comes acute congestive attack. There is a sudden pain in the eye, there is a headache, marked dimness of vision is there is a photophobia and lacrimation. This is the active stage where the patient complains of all these things, and you have the signs like lead edema, then the conjunctival congestion and chemosis is there. So you can very well diagnose the case as the acute congestive glaucoma. So in this stage, there is a steamy and insensitive cornea. Anterior chamber is very shallow, pupil is semi-dilated, oval, fixed, iris discolored, intraocular pressure again markedly raised. Ophthalmoscopy is not possible at this stage because patient is not at all cooperative. Patient used to yell like anything because of the pain, so it is not possible. Vision very much markedly reduced, and the other eye also may get affected many times. So whenever you see these things, just give patients some symptomatic treatment. Which treatment? That also I am saying carbonic anhydrase inhibitors, prostaglandin analogs and all that. So we are going to that also. We are going to see that also. Then the chronic congestive stage, here the IOP is constantly raised. This stage definitely damages the retina very, very much to a great extent. Eye is always congested, irritable, visual field defects are there, and visual acuity is again decreased markedly. And then if all these stages are ignored, then there comes the stage of absolute glaucoma, in which there is painful eye, irritability is very much there, the patient becomes blind, completely blind, perilimbal reddish blue zone is there, then the bullous keratopathy is there. What is that? That is the endothelium of the cornea becomes completely swollen, irreversibly swollen, and that is called as bullous keratopathy. AC again very shallow, iris atrophy changes are there, pupil fixed and dilated, optic disc, glaucomatous optic atrophy will be there. But if the cornea is hazy and the keratopathy is there, then it is not possible for us to go for the, we will not see anything in the posterior segment. We can't see the retina. And again, IOP, as IOP is raised, the eyeball is stony hard. So always remember, try to, in your initial stages, if you are in UG or first year PG, always try to see the intraocular pressure digitally. First, you be a master in that. Then if you feel that digitally the intraocular pressure is raised, then you go for the shears, then you go for the applanation, okay, like that. So you should, what I mean to say is that you should be very good clinically. Every time you should not depend on the instruments. Even if you don't have the instruments, even if you are practicing at a rural level also, then also you should have that skill to diagnose the patient and treat him properly. And now that is the acute stage which we have gone for, the 5 stages, and which turns ultimately the 4 stages, and then which turns ultimately to the absolute glaucoma, which is irreversible, which where we can't help the patient. Now comes the main hero, that is primary open angle glaucoma. Why I am saying it? Because it is a silent killer of vision. It is usually asymptomatic. Patient comes to us at the advanced stage where we can't help the patient. Okay, so why it happens? Because of the thickening and sclerosis of the trabeculae and an absence of giant vacuoles in the cells lining the canal of Schlenk. So that is the pathogenesis actually happening in the primary open angle glaucoma. Now, what are the signs and symptoms? As I told you that it is asymptomatic many a times. That is why patients don't come to the doctor, to an ophthalmologist, and the disease progresses. Patient may experience mild headache and eye ache sometimes, but not always. Sorry. There are occasional visual field defects, but what happens that patient doesn't approach to an ophthalmologist in this disease because he don't have any symptoms. Unless and until you have symptoms, you will not go to a doctor. And that is why if the patient patient seldomly comes to us, and we go for the vision, and the vision is normal, then many a times the ophthalmologist misses to see the retina. It happens, but make it a habit, my dear young friends and students, to go for the slit lamp examination and retina. I always tell my parallel students that whenever patient comes to you please go for the visual acuity, and then you go for the slit lamp examination, and then you put the tropicum eye drops, dilate the pupil, and see the fundus. Unless and until you have that habit of looking into the fundus, if every patient you will not be able to diagnose the things like ARMD or macular degeneration, or this glaucoma also, even peripheral or RP or atrophic changes. Many diseases are there. If you try to see the normal disc, then and then only you can see the pathological disc. Okay, so what your mind doesn't know, your eyes can't see. So please study well, and then you can have the proper clinical knowledge. Accommodative failure is also there. The presbyopic glasses frequently changes. Usually the presbyopic glass should change every after 5 years. But if the patient comes to you every after 6 months, twice if the patient comes, then please always have a doubt in your mind that the patient may have the POAG, and please go for his fundoscopic examination. So what are the signs? Again, signs are also very less there. The normal, their anterior segment will be normal, unlike the what is there in acute stage, that is always shallow. Here it is normal. So in late stages, the pupillary reflex is sluggish. Okay, that is in late stage. Optic disc changes, also early glaucomatous changes can be there, but many times that we may ignore them, or we may not notice them. So why we may do that? Because we don't have the habit to see the fundus. So always have this habit to see the fundus, to judge the cup disc ratio, so that you can have the, even if there is early glaucomatous changes, even if the cup disc ratio changes to 0.4, 0.5, then you can very well diagnose the things. Okay, and the visual field defects are always there, but in the late stage. These are the complications: corneal ulceration, staphyloma, phthisis bulbi, that is shrinkage of the eyeball, which is again irreversible. If corneal ulceration is there, and the reflex, the prolapse can be there, iris prolapse can be there, and there will be the again the opacity will be there. So these are the complications. Please don't let these complications happen to your patients. Okay, treat the patient early, because before that, diagnose the patient early. Again, diagnosis, the gonioscopy you can go for, dark room test, mydriatic provocative test, colored, have you can very well do it, or I would like to say that you please go for the fundoscopic examination directly, so that you can have the idea. Then here this word again came, that management. The here we have to manage. We are not treating the patient, we are managing the patient. Okay, so management is there, and the purpose is to preserve the visual function by controlling intraocular pressure, and the therapy preventing or retarding further optic nerve damage. Status quo, the management aims to maintain the status quo of the patient. Okay, so what management we can do, that the management depends upon the medical, surgical and prophylactic. So medical therapy, whenever there are n number of drops in the market nowadays, which aims to decreasing the production of aqueous humor and increasing the aqueous outflow. So that is the aim for the medical therapy. Whatever drops you take in the market, either they decrease the production of aqueous humor or increase the outflow. Either or, nothing else. No any third purpose is solved there. Then if the medical treatment fails, then the surgical treatment comes into the action, and the prophylactic treatment according to the modern. All these are why I am telling you that as Zadav sir told me that many students, UG and PG students are there listening to me. So there are some medicines which we used to we prescribe in the treatment of glaucoma. Okay, timolol malate is there, 0.25 or 0.5%. Betaxolol is there, levobunolol is there. But all these medicines have this or that side effect. Please, my dear friends, listen. Okay, so there may be hypotension, bradycardia, fatigue, shortness of breath, like to this topical beta blocker. So whenever you give the patient with caution. Okay, it is not like that patient comes to you for glaucoma and you prescribe timolol malate and patient will be fine. It's not like that. There are effects also and there are side effects also. Now, as I told you, the medical therapy aims on two things. Okay, either they decrease the production of aqueous or increases the outflow. Here, this topical beta blocker, what do it do? It decreases the production of the aqueous. Okay, so which medicine is helpful for what purpose, that you must know. That is why I am focusing on this. Then comes the hello, sir, can you hear me? Hello.
Yes, madam. It's
Okay,
audible,
sir.
madam.
Oh, great, sir. Because there is no noise there, no, so no one is.
Okay, continue, ma'am, please.
Just a minute. What happened? Just a minute, sir. There is some problem in my this thing. It seems like that.
No.
Give me a moment, sir. There is, I think I have the connectivity problem.
It's okay, madam.
Oh. Arey, what happened, yaar?
Maybe network problem, madam.
Yeah, but you can hear me, no?
Madam. Only slide will not visible, madam.
Yeah, actually, my computer hang ho gaya. My computer is on hang mode. Hang mode.
Then you can continue with orally, madam.
Yeah, that is what I am also thinking. हाँ वही तो ब्लॉक हो गया, क्या हो गया मुझे नहीं पता चल रहा है, बट आप सुन पा रहे हो ना मुझे? यू कैन हियर मी? मेरा आवाज आ रहा है? आवाज भी नहीं आ रहा है। दर्शना?
आ रहा है मैडम, आ रहा है मैडम,
क्या
आवाज आ रहा है।
हाँ, आपके इसमें लगा है, आपका चालू है, जूम ऑनलाइन है आप? चलो फिर उसमें लेके चलते हैं। हाँ ये स्टॉप हो गया, ये लगा दो, ये लो जूम ही लगा दो उसमें, तब तक मैं शुरू तो कर देती हूँ। ये बंद हो गया तो कोई बात नहीं, ठीक है। सो सर यू कैन हियर मी राइट?
हाँ मैडम, 100%.
Okay sir, that's great. So whenever we go for the medical treatment, there comes the, as I told you, the topical beta blockers are there, which decreases the production of the aqueous humor. Then comes the chronic, the carbonic anhydrase inhibitors. What happens, what they do, it reduces the formation of the aqueous. Again, just like the topical beta blockers, it is up to the doctor to see which type of medicine they have to go. But the acetazolamide is there, which we used to prescribe orally. Okay, so this reduces the raised intraocular pressure, it relieves the ischemic changes in the iris, so that is the added advantage here. And it also decreases the corneal edema. So whenever there is the corneal edema and this thing, so along with the topical beta blocker, you can give these medicines. Okay, then comes the pilocarpine or timolol malate, as I told you. And then the hyperosmotic agents are also there, like mannitol is also there.
बुद्धि सर,
ಹಲೋ ಸರ್.
ಮೇಡಮ್ ಅವ್ರ ಎಕ್ಸಿಟ್ ಆದ್ರೆ?
ಹಾ ಸರ್, ಎಕ್ಸಿಟ್ ಆಗಿದ್ದಾರೆ ಸರ್.
ಸರಿ, ಜಾಯ್ನ್ ಆಗಲಿ. ನೋಡೋಣ ತಡಿ ಸರ್, ಜಾಯ್ನ್ ಆಗಿ.
ಮೇಡಮ್ ಎಕ್ಸಿಟ್ ಆಯ್ತೇನ್ರಿ ಸಂತೋಷ್?
ಹಾ ಸರ್, ಎಕ್ಸಿಟ್ ಆಗ್ಯಾರ ಸರ್.
ಸರ್ ನೆಟ್ವರ್ಕ್ ಪ್ರಾಬ್ಲಮ್ ಇರ್ತದೆ. ಓಕೆ, ವಿಲ್ ವೇಟ್.
Yes. Sorry for the disturbance, sir, because the network quality was very poor, so I have to leave the meeting. So are the students there? Shall we continue or shall we stop here?
Continue, madam. Students are there, madam.
Okay, sir. Okay. I think there is same issue also. So the network is very slow, very poor.
Madam.
I think I will not share the screen now. I will try once. Otherwise, I will.
Madam, if it is a network problem, otherwise directly orally we can start, madam. No problem.
That is what I am also thinking, sir.
Yes, sir. If it is difficulty sharing the PPT, you
Yes.
can take orally, madam. No problem.
Yeah, that is better. That is always better.
Okay.
Okay, sir. Yeah. So there are some things, but in PPT there are some things which I wrote very nicely, sir. Anyhow, so while going for the, so when we are talking about the oral, the medication. In the same way, there are some surgical interventions also. So the trabeculectomy we can do. We can go for the trabeculectomy. SLT or the argon laser trabeculectomy is also there, and then the prophylactic treatment is there. So these are the things that are there in the modern medicine. Okay. So as I told you that they aim for only two things. One is the one thing is that the then the outflow, they will increase the outflow. So these are the two things which usually in the modern medicine that they used to do. But even when we have we went there for Sridhariam for this glaucoma treatment protocol for considering what we can do for finalizing what treatment exactly we can do. There also that the modern astrologists also said that we can control the pressure with the help of these medicines. But if you Ayurveda people can do something for to restore the, to regenerate the ganglion cell layer, or to stop the and I am sure that with the help of Ayurveda we can do that, because it is very much possible for us to to what we call, with the help of our Rasayana Chikitsa, it is very much possible for us to control, to arrest the ganglions and cell layer damage, and even to regenerate the ganglions nerve cell layer. Okay, so so is my PPT visible, sir?
Not now, sir.
Not visible. Okay, no problem, sir.
It's visible, madam. Visible.
Is it visible?
Madam.
Okay, sir. Yeah. As I told you, the trabeculoplasty and all that. Now, this is the thing which I want to tell my students, that what are the things to avoid in glaucoma. It is not that all the things in Ayurveda and yoga are good. Here, it is very much important to keep, don't allow your patient to take the position in which your head is below your heart. So that will again increase the intraocular pressure, and that may trigger to the attack. So it is always better better to avoid these things. Okay, so whenever you do, if the patient is doing Shirshasana, stop him. Though Shirshasana has so many advantages, but still you don't allow your patient of glaucoma to go for Shirshasana. Then the high trans fatty acid diet like baking, baked cookies, then the French fries, cakes, and donuts. My dear young friends, please, if your mother or father is having glaucoma, then please you try to stick to the Saracha, to Sadvrutta, and please avoid these things, because if you are fine, then and then only you can treat your patients also. So please, you educate, try to educate your patients also, and you please keep in mind that these are the things that you should not have in your food, as your food. Okay, once in a blue moon it's okay, but not always. Okay, and you have to avoid the stressful conditions. I know that today's life is very much stressful. Right now also I was under stress for 10 minutes. So because what happened to my network, I was having such a strong network, but still it didn't work when I want it and all that. But it's okay, it happens. Okay, so please don't take stress of the things which are not in your hands. Now moving to Adhimantana, Manthanavata Vedana, the disease where the Manthanavata Vedana are there. So that is called as Adhimantha. Why I am telling you, before telling Adhimantha, why I have briefed about glaucoma, that the symptoms are very much the same. And here also in the acute congestive glaucoma, what they told that there is the sudden loss of vision is there, then there is the foggy cornea is there will be the field defects and all that. In the same way, Sushruta also said that in acute stage, the vision will be lost in 3 days, 5 days, or 7 days, or like that. Okay, depending on the dosha which is involved there. So, as I told you in the first lecture, in the first while talking in the first line is that the root cause of all the netra rogas are abhishanda. Okay, so clogging and blocking of the vessels in the eyes leads to the excessive secretion from some other place, from some other source thing, from some other source, or from some other place, and that may lead to many diseases, including glaucoma. So it is included in the Sarvagata Roga. Don't try to correlate every term. It is not that the glaucoma is equal to Adhimantha, but whenever patient comes to you, patient will not come to you with the terminology Adhimantha. The patient will come to you as acute congestive glaucoma or primary open angle glaucoma. So that is very much important for you to understand. That is why I am saying that. So as you know that there are 4 types of Adhimantha. So Vata Adhimantha having Lakshana as Aranimata Manthanavata Vedana. Vedana is always there, Manthanavata Vedana is there, but in Vata Adhimantha, Nasti Vata Drute Ruja, as you all know. So here there is a severe pain in patient's eye. Okay, there is a Sangharsha, there is a severe pain, and that pain is of type Sangharsha. Sangharsha, you can, what I'm not able to tell you what exactly I want to say, but this word itself is sufficient for to tell you that what type of pain there can be. Then there is a Toda Bhedavata Vedana, there is a Akunchana of the Sankocha of the eyeball, and the Sirasardha Vedana. Hemicranial headache is always there. So this Vataja Adhimantha, we can correlate with the acute stage, as there also the pain is there. But it is not necessary to correlate the things. Okay. Then comes the Pitta Jadimantha, which has the Raktaraji in a netra. Vanni Iva Dayate, that is the specific cardinal symptom in Pitta Jadimantha. Then Yakruta Pindopama Netra Golaka, the eyeball becomes so red like Yakruta. Okay, always remember. But for your kind information, I haven't seen such patient. But I have seen the patient having acute congestive glaucoma, where there is acute redness in the eye. So we can put this Pitta Jadimantha there also. Okay. Then the Ksharanavata Vedana is there. Ksharanavata Vedana is there. Then comes the Kapha Jadimantha, where there is Taptatha, Strava, Kandu, Shaitya, then the Gaurava, Paichilya is there, and the Dushika Ayukta Netra, Malayukta. Because the sclera is so muddy that we can very well see that the kapha is affected there. The kapha dosha is more affected there. Then comes the Raktaja Adhimantha. Here the typical name Bandhu Jiva Pratikasham. Usually this shlok is always there for the fill in the blanks for your MCQ, I think. So this is very favorite shloka of all of the Shalakis, I can say. Then the eye becomes red. Okay, there is a difference between redness. The Yakruta is red in different way, maroon red, and this in Raktajadhimantha. Have you seen this Bandhu Jiva flower? So it is bright red there. This flower is bright red in color. So this type of redness is there in this Raktajadhimantha. Now coming to the, whenever you may diagnose glaucoma, you may diagnose acute congestive glaucoma, you may diagnose POAG, you may diagnose Vata Java Abhishanda, Kafaja Abhishanda, Kafaja Adhimantha, all that. But the treatment protocol, for according to me, what I do in my practice, according to me, the treatment protocol is same. And this, as there in the modern medicine, while talking to you about the modern medicine, I told you that is the management. But here it is a Vedana Sadhya Vyadhi Sushruta same. Nothing to worry about Adhimantha. All that pains, there is a lot of pain there for the patient. Okay, but there is nothing to worry about the treatment. So Langana, as I told you, Akshi Kukshi Bhavarogaha. This is my favorite shloka. I'll always chant this shloka. Akshi Kukshi Bhavarogaha Pratishaya Vranajvaraha. There are many. There are two diseases for Shalakya here. Pratisha is there and Akshirog is there. So there are, again, Pratisha is also the root cause of all ENT diseases, we can say. And here the Abhishanda or Abhishanda is the root cause of all Netra Rogas. So just with the help of Langana, you can very well treat the patient, my dear friends. Okay. Then comes the Deepana Pachana Chikitsa. Ghruttapan is the most important part while treating any ophthalmic diseases. I am talking, my dear friends, about Ghruttapan, not about Darpan. Please keep in mind. Okay, so Ghruttapan means this is the Abhyantar Chikitsa. Then comes Mrudurechana. Whenever there is the ophthalmic disease, you always ask your patient to go for Rechana. Now, as you all know that due to this, as this Sharad Rutu is there, so we always ask the patient to go for Sharadiya Virechan. I thank Dr. Vinod Zadav and Dr. Santosh Pujar for giving me the opportunity to talk on Netra Rogas in Sharad Rutu. So please, my dear friends, you first yourself go for the Langana. Then you go for the Ghruttapan, you go for Mrudurechan. Please, those who are having myopia, and I'm sure there must be so many students who is having myopia. You please go to avoid the degenerative changes at the age of 50. You please, today you use this Sharad Rutu, you go for the Langana for 3 days, then Deepan Pachan Chikitsa for 3 days, then have Ghruttapan for 5 days or 7 days, depending upon your Agni and Jaran Shakti, and then go for the Rechana. If your Agribal is good, then you go for the, and you are Pritta Prakriti, then go for the regular Virechana. There is no need to go for the Mrudu Rechana also. And whenever the patient comes to you for glaucoma, patient will say that what doctor is not giving me any medicine and asking me to fast or to take Langana. That is not done. But please convince your patient that this is the best and basic therapy for the disease. Okay. Then comes the Shiro Virechana and Sira Ved. Shiro Virechana depending on the on how much the Rugna Bal is there and Rogi Bal is there. Okay. Then comes the Sira Ved, which is the Vedana Sadhya Vyadhi. Okay. Then you go for the Jalaukavacharan, for Sthanik Apanga, Jalaukavacharan, and then Agni Karma. So you always remember this is the treatment protocol for any patient coming to you for. I would like to say that this is the protocol for all Netra Rogas. Okay. but specifically for glaucoma. Now, one by one, whenever if you take out the book and you start reading, then there are so many things told in the books. But first, you have to go for Langana, Deepana Pachana, Grutapana, Mudurechana, Vishuro Virechana, Siraveda, Jalogavacharana, and if needed, then Agni Karma. And I'm sure, my dear friends, it will take hardly 1 month or 21 days. Okay, Mrudurechana, then you go for the Samsara Jaganam for 3 days. Then you ask the patient to go for Shirovirechana Nasya for 7 days. Then go for Siraved. It will take 30 days, not more than that. And patient will be relieved markedly, I am sure. Then comes this Sthanika Chikitsa. If the patient is not convinced by you to have only Langana, then you can add these treatments along with the Langana Chikitsa. Langana is also very important Chikitsa, always remember. You can go for, as you all know, that there are these 4 things are there which we use in Samavastha of the disease. Seka Ashtotana Pindi. Okay, so whenever there is a Samavastha, Tivra Avastha, you know that the Sama and Nirama Netra Rog Lakshana, I hope. Okay, so all these Lakshanas are there in the Adhimantha. When they are there, then please use these 4 things. Okay, and when these symptoms subsides, then go for Anjana and Tarpana. And of course, Pathyakara Ahar Vihar is the most important thing in any disease. May it be glaucoma, may it be Adhimantha. Okay, then as I told you, this is my favorite shlok. I put it here also. Langana for Langana. Then Grutapana, Purana Gruta. Again, one more tip for you. Start collecting Gruta. If you collect the Gruta in 2020, it will be Purana Gruta at least 10 years after in 2030. So you can use that Gruta at the rate whatever you want, because it will work like Amruta. I am telling you. So please, आज मेरा कुछ सुनो ना सुनो, बस कम से कम 4-5 किलो घृत लेके रख देना, बस एक इसमें लेके, and just don't do anything with that घृता. After 10 years, take that घृता out. आपकी प्रैक्टिस भी अच्छी चल, अब आप इससे बाहर आ जाओगे, आपका पढ़ाई खत्म हो गया होगा, and then you will be there in the practice and you can use this पुराना घृत. Please make it a habit. हर साल, हर 6 महीने में ऐसे घृत का डब्बा लेने का, जैसे हम जलोका को लगाते हैं ना, वैसे उसको लेबल लगा देने का, and after 10 years that घृत will be purana घृत and will work as a amruta. Please remember and please implement on that. Then the virechana, as I told you, as per the roga bala and rogi bala. Okay, vyadhi bala and roga bala, rogi bala. Then of course the Samsarjan Kram comes for 3 to 7 days, depending on again the Agni of the patient and Abhyaran Shakti and Jaran Shakti of the patient. Then the Siraved, as Siraved is the basic thing that you have to do here. Immediately also when the patient comes to you, then in acute stage also you can go for Siraved, you can go for Jalokavacharan, Sek, Ashtotan Pindi and Bidalak, all these things you can go for these treatments along with Langana and Deepana Pachana, so that they will help the Samata to come down, and along with that, and that will help you to so that the patient will be ready for Grutapana. Okay, so that is very much important. So in this way you can now again I think the same thing is there. No, okay, that's great. Yeah, so now for what there are very simple things which we can use in our practice. It is not like that you have to take Suvarna Bhasma or a Rajata Bhasma and then only the patient will be cured. It's not like that, my friends. Okay, just with the Seka, with the Anupama, because it is Vataja Adhimantha, here we want the Kledana Karma. So that is why the Anupama Rasa is there, added with Amalki. Amalki is again very much important. Okay, then either if you don't have that, if you don't have the time to collect the Anupama and take the rasa of that, then you just go for the Eranda Patra, Eranda Twak and Najadugdha. Even though if you don't have Aja Dugdha also, take Godugdha, add some Sendav and go for Seka. This is the best remedy for Vata Adhimantha. It will not cost you for more than 20 rupees, but patient will give you 2000 rupees where if the patient gets relieved with this. This works like a miracle. Then the Haridra Rasona and Rasona Siddha Gogrutan, so you can use there. So the Seka is done. Then you can go for Ashtotan with Broth Panchamul Kashai. Again, each and every Ayurvedic practitioner is having Dashamul with him. Please take Broth Panchamul and Lagu Panchamul separately so that you can very well use it in Netra Roga. You can have you also have Erendamul in your OPD. So you can even use Erendamul Kashai for Ashtotana. Shigru Patra Kashaya, Shigru, as you all know, it is very much Chakshushya. So you can use that also. Then for going for Pindi, again, Eranda Patratwak. And I am telling you very simple formulations which you can use at any dam level, at your OPD level where there are no much facilities are available there. So all these things you should, but all Brohat Panchamol, Lagu Panchamol, Erandmol, Shigru, then the Lodra, Yashti, Trifla, Amalki, Haritaki, Bibitaki. You must have these things in your OPD, and I am sure that everyone will be having that. Then comes the Pitta Adhimantha. I always tell my students that please take 10 drugs which are Vyatagna, 10 drugs which are Pittagna, and 10 drugs which are Kafagna. Okay, and 10 drugs which are Tridoshagna. So you can use those drugs more or less in many treatment protocols. So like whenever it comes Pittaja, there comes the Chandana and Nimba, Yashti, Rasona, Sandava, Madhu. You can have the Seka with any one of them or in combination of them, whatever is available with you. Don't tell your patient that I don't have this drug, so I will treat you tomorrow or day after tomorrow, I will take the medicine. It's not like that, my dear friends. Whatever resources are available with you, you please go for that and treat the patient. If you don't have anything, you can have the milk, you can have Senda, and just go for that also. Okay, don't get excuses for the treatment. You can have all these things in your OPD. Nimba Patra, Lodra, Draksha, Yashti Madhu, Jivaniya Garna Dravya. If they are not there, now they are extinct, so you can use another Shatavari, Ashwagandha, all that, and you can go for that also, okay, for the Ashtotana purpose. Bidalak, again, all Pittagna Dravya, you can go for Bidalak, including Gairik. Okay, I am sure each and every Ayurvedic practitioner is having all these medicines in his OPD, in his or her OPD. So these things are not that much costly also, and not it is not like that they are very costly and you are not supposed to provide that. So you can very well take these medicines and treat the patient with of Adhimantha. Now coming to the Kafaja Adhimantha, here also Nimba, Lodra, Sandhava, Gruta Jala, Ashtotana. Then the Pindi, you can go for the Nimba Patra Pindi or Shunthi, Nimba Patra plus Shunthi Pindi also you can go. Then with the help of Darvi, Haritaki, Vacha, Gairika and Shunthi, you can go for the Bidalaka also. If you don't have anything, just take Trifla and do whatever you want to do with that. That is the best Chakshushya Dravya used in the Samavastha of the patient. Then comes the Raktaja Adhimantha. Again, this is acute stage. Bandhu Jiva Pratikasham, as I told you, that is this sign here we can see. Again, Trifla, as I told you, Trifla, Lodra, Yashti, Musta. Again, as I told you that please take 5 kg Gruta today, and in on 16th of October 2030, it will turn to Purana Gruta. In the same way, please if you can, then please try to collect Aja Gruta, prepare Aja Dugdha, prepare Aja Gruta from that and keep it aside for patients who are suffering especially from Netra Roga. Okay, Aja Gruta and Aja Dugdha are again makes a magic in treating the Netra Rogas. So there are some things, and the Pashupada Yoga Varti Anjan you can use for the Anjana purpose. And after all these Sama Chikitsa, when the patient comes, goes into the Nirama Avastha, then you can go for the Tarpana. And again, Tarpana also helps a lot for the patients of glaucoma. So you please follow this treatment protocol: Langana, Deepana, Pachana, Virechana, Grutapana, Virechana, Shiro Virechana, Raktamokshana, Matlab Siraved, and then Jalokavacharan, and if needed, Agni Karma. You can go with this treatment. Along with that, whenever you go for the patient for Langana and Deepana Pachana, you can continue with Sek, Ashchotan, Pindi, and Bidalat, which are used in the Samavastha of the treatment. So what are the things that have to be avoided in Adhimantha? What are the apathyas in Adhimantha? That is Ushna Tikshna Ahar. So all the things which are there in the name of fast food comes under this. So please avoid. Once in a blue moon you do have samosa, kachori, whatever, pani puri and all that. I even don't know the names of those things. If you will be surprised, I haven't tasted pani puri yet, and my life is going on, my dear friends. Okay, so it is not that unless and until you take those foods, it will be very how can you live? It's not like that. कोई जीने मरने का सवाल नहीं है अगर आपने पानी पूरी नहीं खाई या बर्गर नहीं खाया. महीने में, साल में एक बार, 6 महीने में एक बार आप खा सकते हो, but not regular. Okay. Then don't use the electronic gadgets excessively. Don't go for the Ratrau Jagara. Okay. Then Avakshira Shaya and Uchrita Shaya are contraindicated in all Netra Rogas, including Adhimantha. All Netra Rogi should not go for Shirasnana. Even Pratishayi also. Then all Netra Rogi should not, are contraindicated for Vamana. You must be knowing that, because it will increase the ocular pressure. Okay. Any exercise which will use your intracranial pressure, intraocular pressure, these are contraindicated in Netra Roga. And what are the Pathya in Adhimantha? As I told you now, thank you again, Dr. Santosh Pujar and Dr. Vinod Zadhav, that you gave me the opportunity to talk in Sharad Rutu about Netra Rog. So please go for Rutu Shodhana. Then after this Shodhana and Samsarjan Kram, go for Rasayana. Amal ki Rasayana, you can very well go whenever there are Netra Rogis, you can go for Amal ki Rasayana. Then Tarpana at least twice in a week, twice, the spelling is wrong, I'm sorry. At least twice in a week you can go for Tarpana. Again, if Tarpana is not possible, patient is not willing to come to you for Tarpana purpose, then just ask the patient to use Netra Pichu at home. Just dip the gauze piece into the gruta, put it in your eyes, and just tie it with the help of scarf, rumal, whatever is there available. Okay, it will also work in the same way like Tarpan. I used to do this Netra Pichu because many a times patient is not ready for Tarpana, but patient does Netra Pichu very willingly. So I always go for Netra Pichu. Then diet, as I told you, Gruta. It should be there in at least 10 grams in your diet, morning and evening. It will not increase your cholesterol, please. Okay. On the other hand, as we do in the yajna, what we do, we put the gruta. Okay. So it will increase the agni. In the same way, if you have the gruta in your diet, it will help your agni. Okay. So then Tiktani Sarvani Laguni Chapi. What diet is called? What type of diet Adhimantha or Netra Rogi should have? Tiktani Sarvani Laguni Chapi. बस इतना ही बोल दिया है, इतने में ही आपको सब कुछ पता चल जाएगा. ओके, तो कैसा डाइट होना चाहिए. And then comes the pranayam. Not all pranayams are good for Adhimantha, but Brahmari pranayam is very good to control the restrictions, or what we call it, obstruction in the trabecular meshwork. So we are working on this treatment protocol also, and we have submitted this protocol to Satyam, that is Science and Technology of Yoga and Meditation, Ministry of Health. So we are, if this project comes to Parul University, then we will be more than happy. So we are trying, we have collected all the data of near about 100 patients. We have celebrated that glaucoma week last year, and we have that data, but we now, because of this lockdown, everything is standstill. So, but now we are waiting for the ministry to give us the green signal so that we can work on this Brahmani Pranayam project. So all these things are there, my dear friends, for glaucoma or Adhimantha and its Chikitsa. Okay. So I once again thank you, SVM Ayurvedic Medical College, for giving me this opportunity, and apologize that in the meantime I have to leave the meeting because of the poor network connection, but somehow I can manage, and I am here again. So thank you very much, Dr. Zadav and Dr. Pujar. That's all from my side.
Thank you so much, madam, for giving a wonderful knowledge with this Adhimantha chapter. Thank you so much, madam. Madam, there is a few questions regarding this concept. Can I ask, madam?
Yes, sir. Just a minute, sir. Just a minute, sir. Again, my screen is hanged. Give me a moment, sir.
Okay.
But you can ask, sir. Yes. Tell me.
Just one question asked by doctor.
Yes, sir. Yes, please.
How Rakta Mokshana will reduce the IOP, madam?
Yes, very nice question. But this question will not arise if the from whom this question came, sir?
Dr. Prema.
Okay, Dr. Prema, you must be knowing the pathology of all netra rogas. Siranusare bhiddoshaihi vigunaihi urdhvam agataihi. Okay, and as netra is the sthan of pitta, and rakta and pitta have the ashray bhava. So here, as you can say that with the help of virechana, netra roga will come down. In the same way, with the help of Siraveda and Rakta Mokshana, Sushruta himself told that this glaucoma, this Adhimantha, is Vedana Sadhya Vyadhi. He said that Abhishanda is also Vedana Sadhya Vyadhi. And he told that you have to treat Abhishanda and Adhimantha on the same line of treatment. Okay, so it helps. So how exactly what happens there at the cellular level, we haven't yet worked on that, but we should work. We have this. Thank you that for giving this topic for my PhD student. Okay, but we will definitely establish the connection between Rakta Mokshana and what you said, the intraocular pressure. Okay, but it definitely helps, as Virechana helps in all netra rogas, including glaucoma. In the same way, Rakta Mokshana, Rakta and Pitta have the Ashray Bhava. And the Apanga Marma, again, Apanga Marma is a Sira Marma. There we can go for the Jalauka Vacharana. And Sarvadahik Rakta Mokshana, and so that will help in reducing the pressure, madam. Okay, so glaucoma, we can say that intraocular hypertension, we can call it as, right? So, but at cellular level, I haven't gone through any research article saying that what exactly happens at cellular level when we go for the Rakta Mokshana. But definitely we should go for that.
Okay, madam. Thank you, madam.
Thank you, sir.
Thank you, madam.
One more question asked by Dr. C.S. Bharati.
Yes, sir.
Any yoga technique help to reduce glaucoma, madam?
Pardon, sir? Hello?
Hello, madam.
Hello? हाँ sir, क्या बोले हैं?
Any yoga techniques helps to reduce the glaucoma, madam?
Yes, sir. As I told you, Brahmari Pranayam works wonderfully in reducing the intraocular pressure. what my theory is there is that is what I told you, that we have applied for the project to Satyam, Science and Technology of Yoga and Meditation, along with our Vaswastamta department, and we are trying to establish the connection between Brahmari Pranayam and reducing the obstruction at trabecular meshwork. So whenever you go for the Brahmari Pranayam for at least 15 times or 20 times a day, this will definitely open the trabecular meshwork, sclerosed trabecular meshwork, and it will definitely help in reducing the intraocular pressure. I'm sure for that, sir. We do practice that and we get the results also. As madam said that with help of Sira Mokshana, Rakta Mokshana, we get the results. In acute stage, we always go for Rakta Mokshana and patient gets relief. But at cellular level, again, in the same way, with the help here in that project, we have collaborated with the modern people also. So they will see the angle of anterior chamber. They will go for gonioscopy, and then we will both work together and establish a connection between Brahmari Pranayam and intraocular pressure. Definitely, sir.
Okay, madam. Thank you, madam.
Yes.
One more question, madam, asked by Dr. NY.
Yes, sir.
Hello.
I can hear you, sir. Tell me.
If we not treated glaucoma in time, what kind of a complication we can face, madam?
If you don't treat glaucoma
in time, what kind of a complication may occur, madam?
Yeah, that was there in my slide also. It may lead to absolute blindness. The stage will come of absolute glaucoma, where there is a complete dilated pupil. Cornea will be insensitive. Patient will be completely blind with one eye, and after some time, the patient will go into phthisis bulbi. There will be a complete shrinkage of the eyeball. There will be complete linganash. What is linganash? Linga of the netra is darshan shakti. So the patient will not be able to see anything.
Okay, madam.
Yes.
Thank you, madam.
Okay?
One more question, madam.
Yes, tell me.
Last question, madam, asked by our PG student.
Okay.
Which Panchakarma procedure will more helps in Adhimantha, madam?
Virechana. Don't go for Vamana. Vamana will increase intracranial pressure as well as intraocular pressure. So Vamana is strictly contraindicated in Adhimantha. Go for Virechana always.
Okay, madam. Thank you, madam.
Depending on the Shakti of the Agni Bala of the patient and the Bevaran and Jaran Shakti of the patient, you go, and the Prakriti of the patient, which type of Agni he is having, whether he is having Tikshnagni, Mandagni, Vishamagni and all that, you give either Mrudu Rechana or Tikshna Rechana to the patient. But without that, Rechana will definitely help you. Virechana is the line of treatment, first line of treatment.
Okay, madam. Thank you, madam.
Okay. Thank you, sir. Shall I leave now?
Madam, thank you very much, madam. Really, it's a really wonderful session, madam. And definitely our student will enlighten by your knowledge, ma'am. Thank you very much, madam.
Yes.
Satya sir, you can continue.
Yeah, thank you very much, sir. Once again, thank you, Vinod Jadhav, sir, Santosh Pujar, sir, More, sir, and Prema, madam, and our principal Das, sir. Thank you very much for giving me the opportunity. That too in Sharad Rutu. Again, I am emphasizing on Sharad Rutu.
Yes, ma'am. Thank you. Thank you very much, madam.
Yeah, bye-bye.
Madam, now I am requesting Dr. Prema, madam, to give vote of thanks.
Yeah.
Thank you. Thank you.
Thank you, madam. Thank you, madam. It's really a very nice presentation, madam. Myself, Dr. Prema Jigri. On behalf of our department and our college, I would like to thank you so much, madam, for sharing with us your valuable knowledge, madam. Thank you, madam, once again.
Yes, thank you. And I once again apologize for the poor network connection, but I can't help you. I can't help for that.
Thank you so much, madam. Thank you so much.
Bye-bye.
Bye, madam. Thank you.